So I am having more people who want to do IVF because they want to make sure that they have the best chance possible of having a healthy child, especially women in their 40s. When we've had patients who have had complications for one reason or another, they go to New York.
Where is policy headed?
In Florida, we've seen repeated pushes for what we call fetal personhood type bills and bills that are related to that could extend constitutional rights to fertilized eggs, fetuses, embryos.
So essentially, like all of that could be impacted. You made this whole investment, you and your partner put your body through all of this. You have, embryos that are in storage, and at a snap of a finger, like legislation can take all that away and impact that. Like that's pretty terrifying. This is Birds.Bees.Bodies, the podcast where we strip away the myths and get real about sexual and reproductive health. No shame, no stigma, just truth, guidance, and conversations that matter. Powered by Planned Parenthood of Florida, we're here to break barriers, challenge the silence, and give you the knowledge to take charge of your health and your future. Let's go. Hi, everyone, and welcome to another podcast episode of Birds.Bees.Bodies. I am your host, Vice President of Communications for Planned Parenthood of Florida, Michelle Quesada, and I am so happy to be back for another episode talking about fertility access and policy impact. Now, if you remember from a few seasons ago, we did have an infertility podcast where we talked about a lot of the barriers and challenges that folks face when they're trying to access this care. And today we're going to talk a little bit more about access, but really looking at how policies shape how folks are able to access this very important care. And to help me out today with this podcast episode, we have two amazing guests. We have Michelle Grimsley-Shindano, who is our Director of Policy and Government Affairs at Planned Parenthood of Florida. And we have Dr. Leah Roberts, who's an OBGYN and specializes in fertility care. Thank you both for joining me. I am so happy to have you here. And if you want to share a little bit about yourself to our audience, I'd be thrilled to hear a little bit more about you, Dr. Roberts.
Hi, I'm Dr. Roberts. I am from South Florida. I'm a Florida native. I did my training up in the Northeast and came back down here to provide care to our Floridians. I was trained as an OBGYN and provided OBGYN care for a short period of time before I did my fellowship in infertility. I'm technically a reproductive endocrinologist, but in addition, I also have training in embryology, and I have done a bunch of policy work for things like expedited partner therapy in Pennsylvania, and then some in New Jersey and Florida as well. So I'm so excited to be working with you guys today and hopefully teaching everyone who's listening a little bit more about fertility access and how the policy in the state of Florida affects that.
I'm Michelle Grimsley-Shindano, Director of Policy and Government Affairs for Planned Parenthood of Florida. I've been with the Planned Parenthood family for about 3 years. And prior to that, I started out my career in policy in the Florida legislature. I was an aide in the Florida House, and then I actually ran for office. And after that, I became a private lobbyist. And so I have gotten to see the policy world from multiple perspectives, and I am excited to be doing work now that I am passionate about and still getting a chance to lobby, but for something that I care about.
Amazing. Thank you both so much. And so I want to dive right in to our discussion. This is such an important topic, and you're hearing more and more people who are becoming more open to learning about fertility and fertility care. So I think the first question we probably want to address is, what does fertility access actually mean? Because I think we hear a lot about, fertility clinics, we hear about fertility treatment, but that's not always just because it exists, right? It doesn't always make it accessible. So can we talk a little bit about that, and whomever wants to jump in?
I can quickly say I think that fertility access isn't just about whether or not you can get IVF. It's whether people can build the families that they want, when they want to build those families, and with dignity and safety.
Yeah. So when we talk about fertility access within the field, when we're doing research, we're looking at three main things. We're looking at the medical access, like are there clinics, are there the specialists, are there embryologists available? But also we want to look at the financial access, the affordability of treatments, the travel costs involved, and the geographic access, because our fertility clinics are not always within a reachable distance for the majority of the population in the United States. And so, yes, if you live in New York City, you might have great fertility access. But if you live in the suburbs of New York, there might not be as much. And especially in the state of Florida, there's definitely hubs of fertility access in areas where it's harder to reach.
You both touched on such important parts of this. It's about number one, having the autonomy of wanting to be able to plan out your future family, right? So that's part of it. But also, like, once you decide on a path, whether that's fertility care through IVF or IUI or just treatment so you can get pregnant naturally, whatever that path is for you. The next barrier that I hear from a lot of people is one, finding the right clinic, right? And making sure you have access in your area, but two, the financial burden and the cost, because it is quite pricey to be able to access fertility care. Can we talk about the current landscape of fertility care as it relates to government and policy? Because I know there's been a lot of talk out there about, well, there should be some sort of help that families can receive, when they want to access fertility care. There was some mention, prior to the elections, on getting that help to families and families being able to access this and not have the financial barrier. We've yet to see that from government. And then there's also insurance companies that many of them don't cover, the employers won't cover this in the policies that they adopt for employees, and it's not covered by your insurance. You have to go out of pocket. So let's talk about that. Let's talk about the landscape. So where does fertility stand right now? Are there any policies that are helping people, or is there just an abundance of a lack of support?
In Florida right now, I think it's very interesting. Um, our state actually has last session implemented a bill, so it's now law, that state employees have as a part of their insurance plan, limited access to fertility care. But again, that is if you are a state employee only. So it's very nice to have that coverage as a state employee. But then if you don't work for the state of Florida, it's not mandated that other employers provide that level of coverage. So it's great that it's more accessible to some, but there's still so many barriers for other people. Right now in Florida, it just feels that it that IVF or fertility care is more accessible if you're well insured, if you live near I-95, or if your family looks like traditional on paper. Other than that, there are tons of barriers in our state still. So it's great that state employees are able to do a little bit more, but that is not true for most Floridians.
One thing that's so important to think about, especially in the state of Florida, is what the insurance does and does not cover. Often they'll only cover if someone needs treatment for, like, because they're going through a cancer diagnosis. They also often have limits on how long they'll store the tissue for. I believe for the new bill from the state of Florida, it's only for 3 years, which, if you're trying to think about your full family and you're going through a cancer diagnosis, certainly your full family may not be complete in 3 years. It may need a longer period of time, and those storage fees can be quite substantial. Certainly we are seeing more and more of these big companies like financial institutions, law firms, tech industry covering IVF, but these are going to be covering people who generally have higher incomes, who were more able to access these treatments to begin with. And, I certainly want all employers to be providing this coverage, but lower income individuals need to be covered as well by their insurance. It shouldn't just be a perk that you get because you work for Google.
Let's talk about, so we mentioned a couple different policies that have tried to help, create some access. And I do want to talk about the trend that we are seeing nationally and in Florida when it comes to reproductive health care overall. We've seen a lot of restrictions put in place in Florida, specifically when it comes to the 6-week abortion ban, the near total abortion ban. And what I hear from a lot of people is that, you know, more and more families are being impacted by these restrictions, who are actually families that are trying to have kids and are trying to get pregnant, but somehow they're still impacted by a near total abortion ban. And I guess so people are like, well, how does that happen? How does this? So I'd love to ask you, Dr. Roberts, like, what have you seen as an impact or unintended impact, I guess, or unplanned, I should say, from a near total abortion ban that on its surface, really appeared to limit the number of abortions happening in Florida, but it's also impacting families who never thought they would need an abortion.
Absolutely. So where I've seen this in my practice the most is people who would have a termination for a medical reason. Okay. So these are people who desperately want their children, but maybe the unborn child has a severe cardiac defect, or did not develop their brain, or did not develop kidneys. These are things that are not compatible with life, right? So they can go through 9 months of gestation because they're basically on life support from their mothers. But once they're born, they cannot survive on the outside at all. And, although there are some exceptions to these kinds of cases to have a termination, because terminations are being so limited, it's really hard to find these providers. And so they may be pregnant for longer. They may deal with a more traumatizing experience. And if our goal is to get them a happy, healthy baby in their arms as quickly as possible by, severely limiting their access to this type of care, it does prevent them from getting to that goal of a live birth as quickly as possible. Additionally, we are a big training state. We have lots and lots of residency programs in medical schools. I went to medical school here, and we're not training the physicians to do these types of terminations. So these procedures that may be completely medically necessary and even allowable under the law are being limited because we don't have the providers who are trained to be able to do these procedures, because they're being done so less frequently and at such specialized centers. So that's where I'm seeing the issue. I have patients who come in who have had a much more traumatic time with their failed pregnancy, and then they come in and are delayed and are wanting to do IVF to have a healthy pregnancy. They desperately want children, but they were affected by this ban and the limitations that it's caused in the state of Florida.
I'm curious, Dr. Roberts, when you have consultations with your clients, with your patients, and explain to them, going through the IVF process or IUI or whichever route they're taking, depending on their situation. Are you having to explain to them that in our state we have a 6-week abortion ban? So should anything pop up, any complication happening with the pregnancy beyond 6 weeks, that's something they need to consider as they're trying to get pregnant?
Let me give some background for some people who might not know. In an intrauterine insemination, sperm is placed directly into the uterus to help fertilization occur. That means everything is done inside the body, so we can't do any kind of genetic testing. In IVF, or in vitro fertilization, the eggs and sperm are combined in the lab to create embryos that are then transferred to the uterus. So we can do genetic testing in those situations. So I am having more people who want to do IVF because they want to make sure that they have the best chance possible of having a healthy child, especially women in their 40s. Certainly, it does not prevent cardiac defects, any kind of congenital defects, but it can reduce the risk of chromosomal abnormalities. So I'm certainly seeing that. And I will tell you, every single day, I have patients ask about this. What will happen if I have an ectopic pregnancy, which, we are lucky enough that we can take care of ectopic pregnancies in the state. That's not the case everywhere. But certainly, when we've had patients who have had complications for one reason or another, they go to New York. They just go out of state, and they understand that that's part of the process. But it does limit my ability to do certain kinds of treatment because I have to be that much more careful not to put anyone in a situation where they won't be able to get the care they need.
Incredible. Michelle, where is policy headed? Because I feel like there's not a lot of acknowledgement of the different sectors of reproductive healthcare that are impacted by these types of laws.
So in Florida, we've seen repeated pushes for what we call fetal personhood type bills, and bills that are related to that could extend constitutional rights to fertilized eggs, fetuses, embryos. That could raise real questions when it comes to IVF, embryo storage, disposal, abortion bans, and legislation that somewhat criminalizes, you could say, also complicate care when it comes to pregnancy loss and high risk pregnancies. And so that's deeply relevant for patients who are finally conceiving after fertility treatment. So it's two competing trends. I also think we're seeing some states pass protections to affirm the right to IVF and shield clinics or health centers from certain lawsuits. And then we're also seeing other states move toward these personhood type bills and these extreme abortion bans, which create the legal risks and could push clinics in the direction of having to close and not provide care. And then you have at the federal level the Right to IVF Act that was introduced in Congress to create a statutory right to fertility treatment, and that included IVF, but it failed to advance in the Senate. So right now it feels like fertility care lives in this like patchwork of state laws and court decisions and employer benefit decisions. So it's hard to it depends on your zip code where you live, and that's kind of unfortunate to say right now.
So the personhood bills is what we saw happen in Alabama, where basically all IVF was shut down in Alabama for a period of time. Now, as an IVF provider, I would love if each and every embryo created a person. My job would be a whole lot easier, and I'd get a lot more patients pregnant, especially in their 40s. You know, if 90% of embryos of people at 44 were not compatible with life as they are now, I would be much happier. I would have a lot more pregnant patients. Unfortunately, you know, when we look at an embryo, depending on if it's genetically tested or not, if it's genetically tested and it's chromosomally normal, it's about a 50% chance of live birth. If it's not chromosomally tested, it depends on the age of the person, but it's even lower chance of live birth. So I would love for all embryos to be able to have personhood, but that's just not the reality. Not every embryo is compatible with life, and so it's just frankly not accurate. Just like when we had the issue in Ohio many years ago, where they talked about taking the embryo out of the fallopian tube and implanting it in the uterus for ectopic pregnancies. Give me that technology. That would be fantastic. It's just not our reality. It's not how human reproduction works. We know that in any given month, at our most fertile, the chance of pregnancy is about 18 to 20%. That's why we have 12 periods a year. Human beings just are not that fertile. Every egg is just not destined to be a live birth. I would love that to be the case, but it's not true. And so our legislation and our policies should reflect the realities of the human body, regardless of how you feel about, some of the political left versus right. There is just certain realities of medicine, certain realities of science. And the science says not every egg is going to be a live birth. Not every embryo is compatible with life.
Wow. And Dr. Roberts, what you were saying and what Michelle said, made me really think about, I mean, it's pretty terrifying in Florida to be a patient considering IVF, in my opinion, right? Because I think that there are all of these bills that are trying to get passed and all this direction that it's kind of in limbo. When you choose the path, and correct me if I'm wrong, for IVF, it's a big investment, and not only financially, but on your body as well. Like, you go through a lot to be able to conceive. And like you mentioned, it's multiple embryos that you have to make to be able to achieve pregnancy, and a healthy pregnancy at that. So you have embryos that are frozen, right? And especially if you want to continue your family down the line, it's not just like one and done. You have multiple embryos that are frozen so that you have options to get pregnant in the future. So essentially, like, all of that could be impacted. You made this whole investment. You and your partner put your body through all of this. You have, embryos that are in storage, and at a snap of a finger, like, legislation can take all that away and impact that. Like, that's pretty terrifying.
So I will share a little bit of personal story. I used IVF to make my second child. I can show you her embryo and her picture right here. This is Savannah as an embryo. Okay.
Oh my
This is
goodness.
her as
For
a
those
live
of
baby
you
now.
on
I
the
use
podcast,
it.
she is beautiful, by the way. I'm seeing the
But
picture of her as an embryo and her as a baby. So cute.
so this is very personal to me. I did 2 egg retrievals, 2 rounds of IVF to make my own family. And my embryos are not stored in Florida. Not gonna lie. I wanted to make sure that I had enough embryos for my full family. We say we want 2 to 3 embryos per live birth. And so I did 2 rounds of IVF because I knew I wanted more than one more child. Um, I was lucky enough to be able to have the foresight and the information to be able to plan something like that. But, on cost alone, that's just not the reality for most American families to even do 1 round of IVF, which can be, $40,000, $50,000 to do 2 rounds of IVF. Um, you know, to be able to complete their full family and not have anyone tell them that they're not able to because of age or resources or access or geography. But you don't want to make a bunch of embryos and store them somewhere where it's not safe and not be able to access it later on either. Thus far in Florida, it's been completely safe, but long-term storage is a big question, and whether it's safe to do that in Florida. I know people have moved them out of other states that have been an issue, like Alabama. Moving embryos out of Alabama during that period of time was a big problem, and it was not legal.
It's difficult when a court says embryo or legislature says embryos are frozen embryos or children, or flirt with these theoretical fetal personhood type um, pieces of legislation. um, they don't work in the labs, they don't work with the patients, and it's just, I think, another point to stress that legislatures and courts need to stay out of our doctors' offices and let our doctors that are trained in this work with the patients.
So my example of this is my parents are attorneys. They're very highly educated, very smart people, very well read. My dad reads about 300 books a year. Didn't know that every cell in our body has the same DNA. Well, if you don't know a basic like that, how can you possibly make legislation about medical decisions? And not that my dad's a legislator, but if someone who I would consider very legally, knowledgeable, very knowledgeable about many topics. I mean, he taught me calculus. The man knows a whole lot of things. If he doesn't understand something that I would consider to be so basic, of every cell in your body has the same DNA, that's the instruction manual for how to make our body. How can I expect these legislators, who may or may not be as well read as my father, be able to make these kinds of decisions and be able to understand the intricacies that come into play for each and every family? I mean, I can tell you, I went to 4 years of undergrad, 4 years of medical school, 4 years of residency, and 3 years of fellowship, where I spent intensive time in an embryology lab to be able to understand. And I still get challenged by my patients who come in with, different reasons for their infertility. If I just don't understand how a legislature is equipped to be able to tell me how to practice medicine.
Do you have any stories, Dr. Roberts, of anything that stuck out of you on how, patients are navigating fertility under these, state restrictions? Anything that's popped up where it's actually interfered and it's been an issue?
I have many patients who are public servants in one way or another. In Broward County, if you are a public servant, at least if you work for the school system, you have IVF coverage. Palm Beach County, we do not have IVF coverage. I have had patients who have switched school districts, switched their whole job, spent their whole career at an elementary school, and moved to Broward County in order to have IVF. I had another, and we're losing good teachers that way. I mean, obviously Broward County is still in Florida, but I live in Palm Beach County. I want my kids to have those teachers, and you shouldn't have to move your job over that. I have another elementary school teacher who took a part-time job at Starbucks because Starbucks provides benefits. And, do I really need her to be working another 20 hours a week when she's probably exhausted dealing with my little brats? Not my 5-month-old yet, but, they shouldn't have to take on a second job in order to be able to complete their own family. They're out there spending so many hours a day caring for my family, my child who's in school. They shouldn't have to take a job at Starbucks or take a job at Amazon part-time to be able to get their IVF coverage. So those are two stories of access issues where, I want my school teachers to be able to have access to IVF, and just because they work for Palm Beach County doesn't mean that they should arbitrarily not have access.
Anything else you all would like to add? I mean, I would love to hear Dr. Roberts. What would really help, aside from creating more opportunities for coverage, insurance coverage for IVF? What would really help, patients have full autonomy over their pregnancies, and even the choice of when they want to get pregnant? What would help at a state legislature level, like whether, or even federally, to help people feel more confident and more empowered to create a family, to start a family on their time?
I think there need to be more protections for employment for people who are going through treatment. A lot of times they need to have many doctor's visits, and that can be really difficult. They may not want to share that information with their employer. I think that infertility is very much based on heterosexual definitions of infertility, creating really structural exclusions. 12 months of unprotected intercourse. How do you do that when you are in a same-sex couple? Certainly for insurance coverage purposes, it's almost impossible for LGBTQ plus to get that kind of coverage. Single parents by choice are also excluded. Those who need donor gametes, like donor sperm, donor eggs, are often excluded. So those should be thought out as well. But our highest predictor of success with IVF is their ability to self-pay. If they can pay for it, you may take donor egg, donor sperm, and a gestational carrier, but these people do come out with babies, and that's just really not how medical care in the United States should be, in my opinion.
I think I would love to see more attention to fertility equity. You have like the major medical groups and even the World Health Organization explicitly call infertility a disease, and they highlight the high cost of treatment as an equity issue. I would love to see that addressed on a policy level. There are definitely racial disparities when it comes to IVF access and outcomes. And some of those things can start with state level attention to maternal care, and especially the maternal mortality rates that we have in Florida. I think that we have to realize and remember that attacks on abortion, contraception, they're increasingly tied to this life begins at conception framework. And that also threatens IVF and embryo research. So I'm interested to see what direction it's going to go in, because the same legislatures that call themselves pro-life are the same legislatures that are making it difficult to create life and develop life, especially when it comes to fertility care and treatment. So I think the next 5 to 10 years will be very telling. But it's very hard to say what direction it'll go in, because it honestly depends on who's in leadership. And in Florida right now, we're about to turn over leadership to someone else. So um, I don't have a real good solid answer.
On a national level, one of the things that I'm also concerned about is we already had a lot lower rate of funding for women's diseases like fibroids, endometriosis, PCOS. And so with the additional funding cuts with the CDC, that's also very concerning for me. I think fibroids particularly need the funding and need the publicity, because they're something that are often suffered through rather than appropriately treated.
I can actually speak to that personally. My husband and I are on our own fertility journey. And since I can remember going to the doctor, have been told, I see a fibroid here, a fibroid there. It's nothing to worry about. So when I'm actually ready to start my family, we can't conceive, and we decide to go to a fertility specialist who says, well, your fibroids are different. The entire lining of your uterus is covered in like one big fibroid. It's not like what I thought was a tumor here or there. And I had to go through 2 surgeries to get all of those removed to even be able to try to begin to conceive again. And I wondered, like, how long has this been a problem? Should I have known about this before? This isn't my first time going to the doctor. And it just makes you think, why did I have to go to a specialist to be able to tell me that this was the problem when I feel like I've been doing all the right things all along? I've been going to the doctor, but have been made to believe that it's just a little tumor here or there. So it, I, I think it's much greater than just about IVF, because now that process got delayed for me. I couldn't get started when I thought I was going to be able to get started. And then I get to the point of, okay, we've removed all of that, but your BMI has to be at a certain place to be able to start the process. And that's a whole nother thing. So I think we also have to look at uh, health and what our health looks like before we're ready to begin to conceive, and start prioritizing laws that and policies and procedures that are helping us to be healthy people before we're even thinking about conception. So when we're ready to make that decision, we're not having to face barrier after barrier.
There isn't a lot that is being done to promote healthcare, and to provide access to healthcare, and not just for for people who are trying to have kids or for people who don't want kids. It's overall, like there needs to be overall health promotion for every phase of your reproductive health care. And I'm just in shock to hear, that's something that you would expect. Like I would expect my OBGYN, if she ever found fibroids, to say, hey, this isn't an issue right now, but if one day you want to have kids, this is going to something you have to take care of. So I don't have the foresight to like think that way, right? But your doctor should have the foresight to say, hey, it's not a big deal right now, but this is how it could impact you in the long run.
Fibroids also can affect other things besides just fertility. It can affect your bowel and bladder function with pressure on your bladder. It can affect, tend to have heavier bleeding every month, cause anemia. There are lots of things. And then that starts going into, well, how many minutes does your OBGYN have to spend with you at your annual visit? Because, there's such a shortage of OBGYNs. They're being pulled to deliveries. They're being pulled in 1,000 directions. We want to make Florida a state where OBGYNs want to work. And if anything, they're fleeing the state. They're not coming to practice down here. So we really should push legislation that allows the OBGYNs to be able to practice safely, productively, but with evidence-based knowledge, so that they do have the time to spend with each and every person and not just be like, oh, you're not trying to get pregnant, annual exam, by you have flat fibroids, but really spend the time to talk about the fibroids and talk about the treatment options and talk about what their future will look like.
Absolutely. Put that just perfectly, Dr. Roberts. I know we're running out of time here. I just want to share with folks that, at Planned Parenthood, we do offer basic infertility care. It's not IVF, it's not IUI. But for some folks who are starting to have some trouble in getting pregnant or don't really know how their menstrual cycles work, like we can work with you, do some basic testing, see if it's just a minor lifestyle change or minor treatment that you need to be on to be able to help you get pregnant. Of course, we always refer to those in the industry like Dr. Roberts, who can help you with more complicated care or ongoing care in fertility. Dr. Roberts, do you want to share? I know people can go on to ppfl.org if they want to learn more about the services we offer. Do you want to share the practice that you're at if somebody wants to learn more from you or from your practice?
Absolutely. I am at Boca Fertility in Boca Raton, Florida. We also have an office in Fort Lauderdale, and I'm happy to see anyone. We also do telehealth, so anyone who wants to come and talk and see me about their own fertility or any concerns they have, we say to come see us if you're less than 35, been trying for a year, less than 40, trying for 6 months, or more than 40 right away. But anyone who has any concerns or doesn't have regular cycles, we're always happy to see you. And really, before you're ready to conceive, you really should have that preconception counseling visit with your OBGYN to make sure you're in tip-top shape and start your prenatal vitamin.
Such a good point. All things I learned too when I was trying to get pregnant. I have a 3-year-old son and a 1-year-old who just turned 1 a few months ago. And after when I told my doctor that I wanted to get pregnant and I was trying to get pregnant right away, they were like, get on your prenatals now. And like, these are things that, people don't tell you and that you have no idea. You usually don't start prenatals until, if people find out they're pregnant. Once they find out they're pregnant, they're like, oh, I should probably go on prenatals. But so many things that you learn along the way. And I agree. I think the lifestyle is so different now than it was decades ago. People are waiting a little bit longer to have children and to start their families. They have careers and other things that they're working through, or haven't found the right partner if that's what they're waiting for. So I feel like just because it's a 5-year down the road thing for you, or maybe longer, there's no reason why you can't just get checked out and see where your fertility stands. So you have all the facts and information ahead. I think more people are starting to do that. I think
And
as
good for your hair and your nails.
Yeah,
your prenatals are good for your hair and your nails. It doesn't hurt to take them.
Yes, even postpartum, like keep on the vitamins postpartum, because I lost so much hair after my last baby, and stopped taking the vitamins, and that was part of it. I was like, oh, I need to get back on those. So all good things. I appreciate you both so much. This is such a good conversation. If you all want to learn more about Planned Parenthood in Florida, go to ppfl.org. We're also on every social media platform you can think of. Find us at PP Florida, and we'll see you on the next one. Thank you both so much for being on our podcast.
Thank you.
Thank you.